Hi everyone, this is Roshni Arun with the North Carolina Medical Journal. Today I am interviewing Dr. Ronny Bell, who is the Fred Eshelman Distinguished Professor and Chair of the Division of Pharmaceutical Outcomes and Policy at the Eshelman School of Pharmacy at UNC Chapel Hill. Dr. Bell's research focuses on understanding and addressing health disparities in underserved populations, with a particular emphasis on American Indian and rural communities in North Carolina. Dr. Bell is also the editor-in-chief of the North Carolina Medical Journal, and in this interview, we'll be focusing on Dr. Bell's editorial priorities moving into the new year, the challenges and opportunities in public health communication, and his hopes for how the journal can bridge between research, community, and policy. Dr. Bell, it's an absolute pleasure to have you here today. Thank you so much for joining us.
Yeah, thank you. I'm looking forward to the discussion.
Yeah. So kind of stepping into the editor-in-chief role, I'm sure has been, sort of a change, but it's been exciting to be a part of the journal during such a transition. And as part of that transition is NCMJ's commitment to digital first publishing. And as the journal kind of transitions into this format, one of the questions we had for you was, what do you see as its most important role in North Carolina's public health landscape?
Yeah, so it's been an interesting journey for me. I've been involved with the Institute of Medicine for a long time, served on different task forces. I was, co-chair of the Healthy North Carolina 2030 Task Force, and served as an associate editor with the journal for many years until I was asked to step into the role that was left when Dr. Peter Morris stepped down, who did a phenomenal job leading the journal for I think it was 11 years. It's more than 10 years. So wanting to continue that legacy that the journal has had under his leadership, it was important for me to have an understanding of where we were wanting to go with the journal, having this, the digital platform that was being created, wanting to increase our reach by, having a better social media presence and, getting the word out in lots of different venues. So that has been, a big push that we have had. And I really feel like, the journal is in a great place right now. There's so many changes going on in North Carolina and across the country. And so I feel like we are, we're not like other state medical journals, which mostly focus on, um, clinical cases, clinical guidelines, things like that. We really focus on policy and public health and the work that's being done across our state. We have a number of great universities across the state. We have a wonderful state health department, Department of Health and Human Services. We have a lot of wonderful community organizations that are focused on health. And so we want to highlight that. We want to be the bridge between those that are doing work in the community and our policymakers. And so I think we have a really strong opportunity with the backing of the Institute of Medicine. We really are that strong voice that can speak in places that others can't.
Absolutely. And kind of on that digital front, as we move into an era where technology and AI is just so embedded into everything we're doing, it's important we keep up with that pace. And the journal has been around for a long time, and it's probably gone through so many of these iterations and changes since its genesis. But it's seemed like there's been a consistent priority in representing health policy and healthcare research surrounding, rural communities and underserved populations, since a lot of these regions represent a large portion of North Carolina's population. And kind of on that note, how has your background as a native of Robeson County and as a member of the Lumbee tribe and leadership in rural health equity shaped your approach to your editorial leadership?
Yeah, so I'm kind of a oddity in academia. I won't shy away from saying I'm 62 years old, and in my 62 and a half years of life, I've never lived outside the state of North Carolina. The longest I've ever been out of the state is 4.5 weeks between my junior and senior year in high school, and so I love the state. I love the diversity of our state. We have the largest American Indian population in the Eastern United States. We have the second largest number of people living in rural communities of any state in the country. So there's a lot of wonderful things that we have that is a part of who we are as North Carolinians, but we also recognize, we have a lot of health challenges. We although the substance use crisis is being abated to some extent. It's still there is still that um, challenge that we face in addressing that issue. Obviously, having come out of the COVID pandemic and the natural disasters that we face, including Hurricane Helene last year. So we just have a lot of unique aspects to who we are as a state, and even our political dynamics. Having a Democrat governor and a largely Republican-led state legislature, that presents some interesting dynamics. Although, 2 years ago, 3 years ago, we expanded Medicaid. So I'm just excited about the role that we can play as a journal in helping people understand all of the wonderful opportunities that we have here, and the resources we have in our state.
Absolutely. I think you're absolutely right. The state holds so much diversity, which is um, why it's amazing that, part of your work is representing this diversity and advocating for this diversity. And your previous experiences surrounding health equity are extensive, and I'm sure, those experiences have kind of comprehensively shaped your understanding of the issues and knowledge that exists in this space. So in that vein, what are lessons that you were bringing from your previous academic and leadership experiences at ECU, Wake Forest, and the Maya Angelou Center for Health Equity?
Yeah, so it has been an interesting journey for me, having gone to school at UNC Greensboro, having worked at Wake Forest, at ECU, now at UNC Chapel Hill. I've got to be a part of a lot of great initiatives, and having the opportunity to have some voice around addressing health disparities issues for, like you said, American Indian rural populations, and doing that in partnership with a lot of wonderful people across the state. And so I've been able to get to know some wonderful people at the state health department, at universities across the state. A lot of community leaders who are really invested in ensuring that our communities are healthier places. And so, my research has has been, I've been in lots of different areas of focus. I have done, research on diabetes, on cancer, on cardiovascular disease, on oral health. And so it's allowed me, with my public health background, it's allowed me to kind of be able to speak in a lot of different places, maybe that other people don't have that opportunity. And so being able to go into community spaces and saying, "Hey, this is what we've learned from the research that we've done, and let's work together to figure out how to address some of the issues that we see from the data, and how we can sustain those efforts to try to close that gap that we see from our data."
Yeah, I think that's definitely one of the best parts of being part of, a scientific community. You can get to interact with such a spectrum of those committed to just advancing health and all these different types of avenues. And as you mentioned, just bringing together individuals together just really help kind of foster that collaboration. And across your research, we were also interested in hearing more about your work with cancer research, particularly through the Lineberger Comprehensive Cancer Center and also your involvement with the Southeastern American Indian Cancer Health Equity Partnership, SICEP. Um, and in your involvement in shaping community cancer research, you've emphasized, the need for culturally competent approaches to research, education, and engagement. And on that note, could you speak about how health communication impacts people's understanding of community health needs, especially in historically marginalized populations?
It's been a kind of an interesting journey back in 2020, yeah, right around 2022, 2021. I was approached about leading the community outreach and engagement program at Wake Forest, at the Comprehensive Cancer Center at Wake Forest, and I stepped into that role. This was my second time working at Wake Forest. And, at that time, this was actually late in 2020. And so, there wasn't a whole lot of community outreach work going on at that time because we were still in the early stages of COVID. But, we did what we could to try to address that issue, to reach out to people in the community. And while I was at Wake Forest, I was able to, given my passion for working with tribal communities, I reached out to my counterparts at Duke and UNC and said, hey, we have this kind of unique opportunity to work with the eight tribes and four urban Indian organizations in North Carolina. And would you be willing to establish this partnership, which Dr. Stephanie Wheeler, who's here at UNC, and Dr. Tomi Akinamiju, who was at Duke at the time, they were very supportive of that. So we created SICEP, and then I came here to UNC, and so Dr. Nadine Barrett now is at Wake Forest in the role that I was in, and Wake Forest has expanded to include Atrium down in Charlotte. So in all of that, we have learned that when you're communicating with communities, be it tribal communities or rural communities, it's so important to understand the context of uh, the lived experience of people in those communities. So if you're talking about tribal communities, understanding what's important from a cultural perspective to people in that community, or understanding what shared values people have, and how those values show themselves in the ways that people view their health, or view the way that they take care of their health. And so, in Native communities, we often times we think about the medicine wheel and having this holistic approach to viewing our health, the mental, the spiritual, the emotional, and the physical. And so, understanding those aspects of the way people see their health, the way they prioritize what issues are important. I mean, the data might show you one thing, but the community might have a totally different priority as it relates to what they think is most important. And so that's, when we do these community health needs assessments, you're really hearing from the community. And so that's why, like the Lumbee tribe, they've done a tribal health assessment. The Eastern Band Cherokee they've done their own tribal health assessment. So having the voice of the people in those communities speaking into what issues they feel are important is something that we really pay attention to and try to be as responsive as best as we can.
Absolutely. That was a great answer. And I think especially now, incorporating diversity and research is just such a crucial component of like initiatives like precision medicine and non-standardized therapies and therapeutic development, which is something that's most successful through culturally competent care and conversations. And it's so important that we utilize our platforms to kind of create awareness about this type of space so we can develop those better treatments. And on that note, how do you think a journal like NCMJ can play a role in promoting culturally relevant and accessible health messaging in policy discourse?
Well, definitely we need to be highlighting those people who are doing it right, who are working in the community and having success in engaging with community leaders in implementing uh, community driven, community based programs, sustaining those programs, showing impact, showing cost effectiveness. And so I think the journal really can be that vehicle to say, hey, we've got this wonderful program going on in Asheville. What can we learn about that where that can be this program could be implemented some way in Rocky Mount or down in Lumberton. So I think we definitely can be the voice to allow people to have a place to disseminate information, either through the journal or through some of our the forums that we host, either through the institute or through the journal. We really can be the place where people can have a voice to speak to the rest of the state and potentially the rest of the country on hey, this is a program we have. Um, this is the way we ensure the success of this program, and these are the ways in which you might be able to learn from what we have accomplished.
Yeah, absolutely. You talked about sustainability, which I agree is such an important component of success. And I think part of our success for the years that we've been active as NCMJ has been, maintaining that infrastructure through the connections that we've fostered over the years. And NCMJ stands at such a unique intersection of, a spectrum of disciplines, which gives us that power to bring together diverse perspectives and conversations surrounding health equity and research. And in what ways do you envision the journal serving as that connector between research and policymakers and communities?
Well, I think like you said, we are in this unique position. I think we have a um, a platform that is easily accessible, that is has a very strong reputation. We have, being housed in the Institute of Medicine and the wonderful reputation that the Institute has. I think if you went around the state and spoke with policy leaders, healthcare providers, public health professionals, and said, what do you know about the Institute of Medicine or the North Carolina Medical Journal? I think essentially everybody would have positive things to say about both. And so I think using that, garnering that goodwill that we have across the state and allowing for there to be conversation around a lot of different issues, I think is very important. I remember several years ago now, not too long in the distant past, we had a forum that was focused on gun violence. And so, we had people from that had different perspectives on this issue speaking as part of the panels and the individual speakers that we had that were part of the forum. And there were a lot of really tough questions that were being asked on both sides of this issue. And so I think, but it was done in a very respectful manner, and it was done in a way to where people really wanted to understand what the other side, how they felt about this issue. And so I think we we are somewhat unique in that uh, we can be the place or the entity that can help foster healthy dialogues like that, to where we have an understanding of very complex issues that impact the health of the people in our state.
Absolutely. I think it is so interesting that even though we're a medical journal, as you mentioned, NCMJ has that forum or conversational component that just kind of forces our audience to really think about those difficult questions. Um, and in addition to quantitative research or just, conversations about these technical components of policy and health equity, I think it's equally important, a component of advocacy that we have is sharing the narratives or stories of individuals who have experiences to share. Um, and on that note, how do you plan to encourage submissions or stories to NCMJ that highlight health disparities in local community efforts?
Well, I think we have our themed issues, and then we have our original research. And I think as we go through the planning process of setting out um, our issue themes, we can be mindful of that. I think we also sometimes we have a tendency to rely heavily on some of our larger institutions across the state, UNC, Duke, NC State. And so one of the things I really would love to be able to do in my role as editor in chief is to ensure that some of the institutions that maybe typically don't publish in our journal don't necessarily have a voice. Some of the HBCUs, minority serving institutions, some of the smaller private schools that are doing excellent work, uh, reaching out to them to say, hey, we really want to hear from you all. We want to highlight work that you're doing, be it um, uh, qualitative research, be it data analysis, quantitative data analysis. We want to hear from the work that you're doing, and so again, I think have the opportunity to take advantage of our reputation and our reach across the state to be able to do that.
Yeah, absolutely. I think having these themes of issues or, even connecting with institutions across the state really give our collaborators or even the researchers we're reaching out to, um, who have a diversity of research experience to really contribute to the journal and get involved. And kind of circling back to the idea of digital first publishing and our online presence, as public health information becomes more accessible online, how can the journal, how can NCMJ maintain that trust and relevance?
Uh, Again, I think we rely on the reputation that we've built for decades. I think we um, people understand that we are a trusted voice. I think keeping to the extent that we can, keeping the journal as accessible as possible, as cost efficient as possible. Uh, Also, again, as I said earlier, we've been intentional about increasing our social media presence, making sure people know, well, like know when a particular issue comes out or when we're having a forum session. So I think that we are in a really good place right now, just because of the work that's being done to ensure that people have access to the work that we want them to have access to. And I think that the restructuring that's been done over the past year has really put us in a place where a lot of the goals that we wanted to achieve are being achieved.
Yeah, accessibility is definitely such a critical component of successful science and successful dissemination of research. And I think the efforts that we're taking on definitely balance some of our old priorities of, engaging with the community, but also exploring new avenues, kind of responding to the increasing demand for social media and online presence. And moving forward as editor-in-chief, what innovations or partnerships excite you most about the journal's next chapter?
Yeah, so I mentioned wanting to reach out to HBCUs, some of our uh, other universities that typically don't publish in the journal. I think we want to be able to reach out to them, let them know that we are a resource for them and a vehicle for their faculty to publish the work that they're doing, even having opportunities for students and trainees to publish in our journal, or at least be aware of the work that we're doing and how they can have access to our work. I think that um, trying to ensure that we keep our connections with the state health agencies. We're so reliant on the very important work that many of the injury and violence prevention branch, the women's health branch, the cancer prevention and control branch. So there's just so many wonderful folks within our state health agencies that we want to make sure that we keep those connections as strong as possible and ensure that they are engaging with us to the best extent possible.
Definitely, trying to make sure that the journal is representative of all the institutions in North Carolina is such an important priority to uphold. Finally, so the journal has been around for a long time, since 1849, I believe. And adapting to the changes of being a new editor-in-chief most likely require a balance or even a combination of the past and the present. And on that note, how do you approach the challenge of honoring NCMJ's longstanding legacy while ensuring it remains relevant and useful for a new generation of readers and contributors?
Yeah, I think the best thing that we can do to ensure that we continue that legacy is just to provide the highest quality content, the most accessible content, content that will engage people across the state, policymakers, public health providers, healthcare providers. Uh, I think I don't know what the motivation was for starting the North Carolina Medical Journal, but I can say that at least in the time that I've been involved with the journal and again taking over for the wonderful work that Dr. Peter Morris did as editor in chief. I have always been an admirer of the work that North Carolina Medical Journal has done. I've been involved. I've been an author. I've been a issue guest editor. I was an associate editor, now editor in chief. So I've been in lots of different roles with the journal, and so it was an honor when I was asked to be editor in chief and to step into Peter's role or the role that Peter played for so long. And so I think for us, the way in which we continue this legacy is to make sure our content is as high quality as possible and as accessible as possible to the people that need to hear what we have to say.
Yeah, absolutely. I think just being able to serve on so many roles within the journal have probably, you know, been such a strong preparation for your time as serving as editor-in-chief. And yeah, I think that having these conversations surrounding health equity and advocacy and representation are just so important, especially in times like now, um, where North Carolina's medical accessibility landscape it has been volatile with changes to Medicaid and things like that. And discussions like um, these having conversations with experts or professionals in the field are just such a helpful step in disseminating the knowledge to the broader community. So, Dr. Bell, thank you so much for taking the time to talk with us at the North Carolina Medical Journal. It's been a pleasure hearing from you today, and we're so excited to continue seeing how your leadership as editor-in-chief continues.
Thank you, Rashni.
Thank you.